What does a pharmacist do? Well, most people might answer that a pharmacist dispenses the medications that my doctor prescribes. Now, I work with a ton of great pharmacists, and one thing that I don't generally see is excitement about pills in a vial. And this is probably because pharmacists have been trained to do so much more. So what can you get excited about in your community? To find out, let's go beyond the scripts. Hey, welcome back to Beyond the Scripts. I'm your host, Will Tuft with Pioneer RX, and today, as usual, we have another great guest with us today. This guest may be familiar to you if you are from the North Carolina state or the state of Arkansas, if you've worked with CCNC or CPESN or Flip the Pharmacy or the Arkansas Pharmacy Association. Megan Smith, PharmD, may be a familiar name. You can find her also day to day at the University of Arkansas for Medical Sciences or working with hopefully future podcast guest Brittany Sanders, the 2020 Pharmacist of the Year Award from the Arkansas Pharmacy Association at the Pharmacy of Wellington. So a lot going on. Thank you so much for carving out a little bit of time to come back and join us again here at Catalyst Pharmacy podcast.
Absolutely. Happy to be here. Thank you for having me back.
So you've been pretty busy. I guess it's been about a year since you were on the Catalyst podcast. Now you're here on Beyond the Scripts. What has the last year looked like for you?
Well, the last year has been able to take a different shift from when we talked previously. It was, of course, all pandemic response, public health response, and getting both our community pharmacy partners, our community back on their feet through 2022, but then, and our education as well, and how we have shifted and had to respond to all that. And we were reflecting a lot about that in 2021. So this last year, since 2022, we've been able to finally okay, what else can we do? And be able to start thinking about, the future, what we want to see now or next. This is the window security. What we want to see next in pharmacy, what we want to focus on. So in the world of community pharmacy transformation, we found a really great partner with the UAMS Northwest Community Health and Research Group. They had a history of community health workers and supporting that workforce, and it was kind of newer to us, and they wanted to address vaccine hesitancy this last year. And so in February of 2022, we were awarded that grant through the HRSA, the Human Research and Services Administration. And so that was our really first introduction into community health workers and how maybe they could be an added workforce and valuable workforce within the community pharmacy setting. So getting all of that set up, that was a large 9-month project, which we extended up until this month. So it's just ending now. We've given an additional 35,000 vaccines through that program.
Wow.
And have learned, it's been really amazing to watch that and be part of that grant and be part of really seeing, well, what does this look like in pharmacy? And so one of my follow-up grants right now is to dive in a little bit deeper to give a resource to all pharmacies across the nation and saying, here's a toolkit or a guide if you want to get into this. How would you go about doing it? We have a lot of lessons learned to share.
Yeah.
So we're in the middle of doing that. But this past year was like, okay, how else can we help our communities? And really just taking advantage beyond the public health emergency. I saw last week, I went to APHA annual meeting, and I saw a slide, or someone shared with me a slide that was there. I was super proud of Arkansas. There was a slide of what happens or what changes after the public health emergency ends in May. Would it change your practice in your state? And all the states, yes, if that goes away, it's going to change things for us. And there were 4 states highlighted that it wouldn't make a difference. And Arkansas was one of those because of all of the legislative changes in 2021 and that legislative session to make permanent a lot of those changes that we were afforded through the Public Health Emergency PrEP Act. And so, so I'm super excited about that. We had, so amongst, looking at the future, and maybe we did a large grant rollout with community health workers. At the same time, this past year, we were writing our prescribing protocols. So in 2021, one of those changes was in Arkansas, we were able to prescribe based on a statewide protocol for point-of-care testing and oral contraceptives. And I led the point-of-care testing development of that protocol. So I was able to design it, present it to the Board of Pharmacy, present it to the Board of Medicine, and I had to present it to the Board of Medicine twice because they had questions. And then in August of 2022, it became officially approved. And so since this past August, that's been another major focus, is getting that word out there and showing people how they can use these protocols and now prescribe. So a lot of action, a lot of action this year.
Okay, so busy year for sure.
Yeah.
That is really interesting to see the studies on, that hesitancy. At the time, of course you can, you're going to have an emotional response to what's going on. There was so much fear about, even going to the grocery store. Of course, a brand new vaccine in such a scary time. There's definitely some interesting psychology and some interesting, kind of social studies to do there. I'll be interested to see kind of what the end result of that body of work is.
Yes, there's a lot of work looking at just the effect of the pandemic in general, but then also a vaccine status and all the some kind of other side projects I have with different groups. They're not really side projects. I'm a smaller part of those. They're really great projects. There's a lot to do with them, but they are looking at specifically how does this impact our rural communities. So looking at characteristics of hesitancy and vaccinations in our rural states as well. And so it's really interesting. There's this the greater play of belief and safety and politics and, all that playing a part.
And what's so funny is that when you think about the kind of mindset that differentiates a rural community, a lot of that is typically because of, an isolated community, whereas social media has completely changed that. So now you have an isolated community that maybe finds an echo chamber for those beliefs or fears or, whatever, that confirmation bias echo chamber online that probably just makes it even more dramatic. So
even more dramatic and harder to dispel and even harder to have that conversation, which is why we really pivoted and leaned in strongly to this idea of community health workers to help bridge that, of being the whole idea of this incredible group of professionals is to be a trusted resource in the community and a local resource, right? It's not me coming down to your town once, or you can see a video from somebody from UAMS that they have no idea who they are, right? So it's having a local community person they can go to at any time and see and talk to at any, throughout the week. And so that's one of the reasons why we really leaned into that as a strategy to help with hesitancy and to talk and give that education and just to be a trusted place to receive information.
And that in itself seems like it's probably the coaching aspect probably bleeds over into every other, chronic disease state, from diabetes to, healthy eating and, all of the typical problems that you may encounter. But once you're building those bridges, you can see where that would definitely help. What's interesting too is that, during COVID, we had so many of those changes. And you said you're one of the few states there in Arkansas that's not necessarily going to see a whole lot of changes in the upcoming months. So what specifically kind of makes Arkansas different? What new, what changed in pharmacy permanently for Arkansas?
We had a large change in the vaccinations that we could give. So previous to the PrEP Act, we could only administer immunizations down to age 7. And now we can go down to age 3. And there's just a couple of carve outs if you have to be in the vaccine for children for anything that's non-COVID or non-flu. But if it's a COVID vaccine or a flu vaccine, you can give it to anyone 3 and up. And so that's going to stay. So that was a large one, and just kind of opening up to all, ACIP approved vaccines too for that, for those age groups. if they're 3 to 7 and it's non-COVID or non-flu, so for anything else, they'll need to be a part of a specific vaccines for children program. So we've also done, there's a good effort through our Arkansas Immunization Action Coalition to get folks credentialed and signed up to be vaccine providers so that we don't lose any county and we're able to provide that access to all vaccines to all children. But that is huge, just to not have that as a barrier anymore to keep that.
Yeah. So I imagine
technicians to immunize also. To all of our
wow.
technicians can immunize. Yep, that's another one. And then those are like, so ability to order and administer vaccines is what's really the mainstay that's staying because of PrEP. And then, we've been able to then, turn around that into prescribing protocols too. That wasn't technically in PrEP, but it allowed us the kind of the background to say, yes, we can do this. We've been assessing these high risk patients. This is how we're going to do it, and we're going to do it the exact same way, continuing on. So it just kind of helped give a little bit of confidence in that we could actually assess and treat.
Nice. So does that include like all of the basic, childhood immunizations that a kid needs to go into the, public school and have all their check marks? Nice. I mean, and in a area with a lot of rural schools, you can imagine where, that must be such a game changer for the local pharmacy, but also for the local healthcare providers. Just to be able to have that assistance is pretty great. And so, with those prescribing protocols, what else changed? What do you see with that? Maybe like Tamiflu and things like that long term, or are there other? Is that kind of open ended, or are there certain parameters?
So kind of the mechanism that we have built in Arkansas since 2017 is to define a statewide protocol. And so we really leaned into, let's create statewide protocols to go that way versus, collaborative practice agreements and making things more specific. We just said, let's have a definition. So in 2017, we passed legislation that was like, here's what a statewide protocol means and what we're going to do and how does this work. And so, a major part of that is having a good relationship with your the Board of Medicine, the medical board. And so one of the ways that we wanted to show that we are being collaborative is that within our definition of a statewide protocol in Arkansas, you have to be approved by both the Board of Pharmacy and the Board of Medicine. So you have to go through both. Both are going to see these protocols and what's involved. And in that first legislation that was passed, we built that off of naloxone and access to naloxone. So that was the first one that kind of created the framework, per se, of what this is and how it's going to work. And then since then, we in subsequent acts, like, we're going to use that mechanism, a statewide protocol, for smoking cessation and over-the-counter products. So that was the second thing that came in 2018. And then in 2021, it was the oral contraceptives and point-of-care testing using CLIA wave tests. So the way that the point-of-care testing bill was written was the use of a CLIA wave test for flu, strep, or other diseases as approved. So,
Okay.
So we are, I think we threw COVID in there. We eventually got COVID in there in the middle, but so it will still take an act of our House and Senate to pass the newest ones, but they went ahead and spelled out flu and strep. So that's where we're starting. And so we created protocols for this treatment of flu and strep. And in this statewide protocol, a lot of collaboration, of course, with the medical board and trying to make something that was useful and easy for the pharmacists to implement, but also that, we got the support of the medical board. So it's pretty specific. It outlines all of our FDA-approved medications to treat those conditions. I have them all in there, but it is specific to their, to that labeling. And
Sure.
so if the FDA changes their labels, which they did on one of them, we kind of got stuck. Like, well, we still have this protocol that has the old label in there. So my advice for others that might be doing this is to try to not put specific SIGs and doses in your protocols, because apparently they do change within a couple of months. And then I have to go back through a full board review to get the protocol updated.
Oh, wow.
But anyway, yes. So they, so that's what was really, and it is very specific, but it outlines and it's of course open to all pharmacists. I'm sorry, I keep hitting my desk, but it's open to all pharmacists to use this protocol. They don't have to do anything else or anything special. It's open to every licensed pharmacist to use it. And so, yeah, it's open. It's great. It's great.
Very cool.
The oral contraceptive ones, we do have a required 1 hour training for pharmacists to do to be able to utilize that protocol. And that is housed out of the Arkansas Pharmacists Association. And they've just been phenomenal. You asked about what is different about Arkansas. I mean, we were speaking differently specifically on the PrEP Act, but my mind went to, man, how did Arkansas get all this to happen and so quickly? And I think that it's just one of the things that makes this state really special and stand out is the strength of that association. They're present, and then when they ask their members, like, oh, we need you here this day, then the members show up, and we're able to get work done quickly. And it's just, I think it's also just a benefit of having everybody knowing everybody and having a smaller set. We have, not quite the diversity or maybe like number of organizations to work with as compared to other states. And so it's easier, I think, sometimes to get to consensus when there's just a smaller number of people.
Yeah, I mean, I think having that strong communication and consistent communication and having everyone on the same page is just great example of teamwork and working towards those common goals together. So go Arkansas.
I know, they're amazing. I just feel great to be here, and they're like, hey, can you write this thing? I'm like, oh, okay, I guess I'm a part of this too, which is so exciting, and it's so very humbling. I didn't know it was coming. I had a couple of meetings set up going, okay, now we can write protocols. Who's doing that? How do you do that? And can I be involved? That was my question. I was like, who does that and how could I be involved? And it turned into, you can do that.
Absolutely, you can be involved.
So, it was so supportive, and everybody is so supportive across the Board of Pharmacy, the board, and then the state association and our colleges, just all work together for a common purpose. And, it's just a really supportive environment for pharmacy.
So you mentioned that you were at APHA the other weekend. You failed to brag on yourself for speaking at APHA the other weekend and having some of your residency program students there as well. So you did. I saw some great coverage of your students there and the community-based residency program. And I believe the class was sculpting the next generation of community pharmacy. So of community pharmacists. So tell me a little bit about that work, because I think that's really exciting, especially since you have kind of, I guess, a concentration on point of care testing there. And it is really interesting to see how that's changed. Of course, COVID just put that in a time warp, but it is interesting to see how, the next generation of pharmacists is definitely kind of looking at a different set of tools out there.
Absolutely. Oh, wow, that's great. I'm going to use that for how you worded that. So my discussion and my presentation at APHA was about sculpting the next generation of community pharmacists through their API experiences. So what are we doing on APIs that is really giving them a new set of tools? I loved how you said that, because and I think part of what drives me into this is realizing that we have a lot of preceptors across the state. We really rely, as a college, we really rely on them to have a very specific set of contributions to a student's learning, right? And it's we rely on them really heavily to okay, that now you're in practice. So we've done what we can do in the classroom. Now you're in practice. Please help, tie all the loose ends together and help them see this in the application. And I think that just even saying that to preceptors of here's what we expect of you, or where we know we can take it this far, we really need you to take it up these next few objectives or what we really expect you to do is something that we haven't talked about a lot, or I haven't even heard much as a preceptor myself. So that was one of my messages of just like, it's really valuable to be an APPE preceptor, and you have a lot to offer. And to your point, the students today need a set of skills that is different than the generation before, or even 10 years ago. They need a different skill set. And I firmly believe that the skill set they need to learn around leadership, management, and how to work with a team, and how are you setting up a pharmacy and working within a pharmacy to address needs in your community, are those needed skills that we cannot do as well in the classroom. I mean, I can tell the stories all day, but for them to be part of that solution and to see, oh, here's a problem, here's how we can address it, is something that I think is so valuable, and a valuable experience that our community APPEs can provide these students. So I described my APPE that I do, which is, if you look at the spectrum of, what kinds of activities should a community APPE have, you might have a spectrum of, well, all of your traditional pharmacy services and dispensing services on one end. And then on the other end, you might think of like problem solving and business management and innovation, right? And in my rotation specifically, I have it set as a community rotation. I started it as an elective, and now I've, was able to get it approved more as a required, one of the required APPEs as well. But it's on this like far end of innovation, and like 80% of your time you're basically trying to solve new problems and work specifically with a pharmacy on a quality improvement project or something that they're trying to do. Like, and a perfect example this past year for us is these protocols, the pharmacy protocols. And so we'd go into pharmacies, where are you at? What do you need? And would help assess them. They're like, we don't know what to do with X, Y, and Z. And so my students would be the ones to help design a workflow for them, or design a protocol for them, or design the checklists and the things, like get them the resources that they need. And that stays with the pharmacy. So they're improving the pharmacy while they're there that 4 weeks, and they go off, onto their next rotation and or graduating, and that pharmacy is improved because of that. And so I like to share that example. But then, of course, if you are, you could be anywhere like in the middle of like, well, maybe it's half the time they're in direct patient services and they're providing their counseling and doing transfers, and they're, helping in the pharmacy in a more quote unquote traditional way. But then I push them, it's like, but maybe it's half the time, they could do something that is carved out. You expect them to say, hey, we don't know much about X, Y, or Z. I don't know much about, am I doing my example from a previous month's rotation? One of my pharmacies was like, am I doing everything right around reporting to insurance correctly when we get reimbursed correctly? I'm like, okay, let's figure that out. So that's what we spend our time on, the things that are would be helpful and valuable to the pharmacies that they're just like, I don't know where to start, or either it's kind of on their back shelf, something that would be nice, but they just haven't gotten to yet. That's where I kind of start with them. And like, I just want to encourage all community APPE preceptors to think of their APPEs in that way. How can it help you with your business, and kind of thinking about the next stage or the next thing that's going on, or something that you want to help improve, because that's something it's a huge learning experience for that student. And individualizing that experience to them, because I know it's going to vary in every state, but I know in our state, a lot of our students work at community pharmacies throughout their pharmacy school, or they've had a lot of rotations and experience. So when they come to me, I'm like, well, what haven't you had? I don't want to just give you the same thing over and over. What haven't you had? Let's make it something different so you can learn and be a part of a unique experience that you could take with you. So anyway, that's kind of what that whole presentation was about. And I got to present with Dan Krinsky, and he was so great. He brought in the how do you justify this, and how do you work with partners to show like that having students with you has a positive ROI. And he even talked about some really tangible activities that he does, and evaluations that he has done with APPE students, using like OTC consults, and even some, like, he has like a scavenger hunt game that he describes. So just different ways to engage your APPE throughout the month. So that's what really we talked about.
Nice, nice. So do you find that you kind of separate, maybe those year one students or the PGY2, like kind of into different paths? Do you try to stay more focused on like fundamentals for, early on and then move into the more creative problem solving, or do you just kind of mix it up throughout the curriculum?
So for my appies, you mean?
Yeah, just in general with any of your residency programs.
Yeah. So with my appy students, and those are fourth year students. So I try to tailor that to where they're at, and they are usually scared because they're used to just being told what to do. And I'm here saying we get to decide what to do, and I don't know what the answer is, and we're going to figure it out together. And you're going to help create something new. And they're like, really? So I have a student on rotation with me right now, and she is has matched and is going to start a PGY1 residency in the VA next or later this summer. And so I brought in a lot of VA specific resources for her to look at and use and kind of show her how she's going to use these skills for her research project. So I try to make that connection. Now with my own personal PGY1 pharmacy residents, you mentioned them too, being at APAJ, super excited that they got to present their own research and do it in person this year. And all together. And for them, each one of them, it depends on their rotation site. And again, what is mutually beneficial. So I've actually taken a lot of the ways that we've designed our residencies, and I'm basically just applying it to appies. Like I'm going backwards. Like the same things that we do in residency. It's identify a business related area that needs improvement. Do a quality improvement project, write a business plan. Your research project should hopefully be supporting one of those two. And so I take those same concepts and now I'm just like applying it backwards into the fourth year, into letting fourth year students kind of get a glimpse at that too. And so a lot of our residents, or my PGY1 community residents, they'll do something, of course, that's within their wheelhouse, but then we try to make it very specific to that business and that site, something that's going to help them and help change what they're doing. Any of our projects shouldn't be just doing it to do it. And it's the same thing with academia. Some folks are like, how are you a faculty member but helping community pharmacy practice? Like, you need to be out there in the store. I'm like, well, I actually am in the store, but they also need the research to back it up of what they're doing. And sometimes, or research to help us make the next decision. Within the protocol space, for example, I did a couple of surveys to understand how much point of care testing is happening in the state. So we could take that as like evidence to saying why we need a statewide protocol, how many facilities we had, what they were comfortable doing. And then one of my surveys, I asked about implementation strategies. What would you need? What support do you need once these protocols go live? And that's all helping now direct what we're doing and how we're serving them. So I think the research really can be such a useful, it's not always this kind of pie in the sky, oh, that just, sounds good on paper. It should be useful. And you should be able to do something with that information. And so that's what a lot of my PGY1 residency projects are about, is usually around implementation science, usually around something that's, should we keep doing this or should we not keep doing this, or how do we do it better? So that really kind of is the basis for a lot of our projects. I want to, where my goal is, now what I have 6 different sites, and the residents spend a whole year, like they have a primary site that they're spending their residency time at. And I really, one of my goals, I think I might be able to do it this upcoming year, but is to bring some project that brings them together, because each of them are doing projects with their specific businesses, which makes sense. And it satisfies all of our competencies and our goals and what we need. But from a research side, I would really love to tap into using all of them to participate on like one common project too. See what that looks like. So that's something that I'm working on.
So are all of those 6 sites, are all of those community pharmacy, or some of those more, chain pharmacy, or do you have hospital pharmacies? What does that mix look like?
Yeah, I have a very diverse mix, and that is intentional. I have 1 independent pharmacy. I have 2 kind of regional pharmacies that span, they're about 40 stores each, and there's 2 of those. One is has kind of a grocery component with it, and the other one does not. I have the UAMS outpatient pharmacy, so that's very unique, and brings in our specialty clinics, so rheumatology, oncology, all the ologies, because there's a long list of them. But they actually will rotate through each of our special clinics as well as our outpatient pharmacy as well. So that's a really unique site. Kroger Pharmacy and Walmart Pharmacy. So I really have a diverse, and I love that because we are able, so I host a monthly seminar with just my residents, because when we first kind of get together and do orientation, I'm like, community pharmacy is really small actually, and there's so much difference between a Walmart and my independent, and I was like, and how cool is it that we get to see and learn together how these very different businesses are addressing similar problems. So when we talk in our seminar, we get together for a half a day once a month throughout the year, and we lead topic discussions and things, but we really get to understand and see the variety of the mix of like, okay, how is community pharmacy as a whole looking at all of our unique businesses and business models? How are they addressing COVID? How did we address that? How are we addressing vaccines? What's going on here? And we really get to hear and see about across the diversity of practices. So it's really, really unique learning experience, I think, for my residents. So that's why I'm very specific that I wanted to create a diverse set. I didn't want them all to be independents or all to be one side, because I want to learn from everyone.
Yeah, absolutely. And really, it's hard to appreciate the nuance and what makes one of those places special without having that lens of comparison. I went to actually had to go to a Walgreens after hours recently for an emergency inhaler. And so I haven't seen Walgreens workflow in 15 years ever that I can remember, but I sat there and it was such a different workflow, and the pharmacist was on such a different mission than you see in community pharmacy, where, she was looking up a coupon card and just all over the place. And it is interesting to compare that and realize, those differences as you're trying to shape your future and what you want to do. It's definitely good exposure for sure. So if you are an independent pharmacy and you are involved with precepting and you're having students into your pharmacy on a regular basis, how can you leverage that to benefit your pharmacy in interesting ways? Because so many pharmacies already, the normal day-to-day urgency and patients coming in every day and the things that have to be done often can kind of overshadow the things that you want to do or want to implement. Do you have any advice for, one of those pharmacies that's like, oh yeah, the next time we're going to do this because things will be different, but things are never different. There's all those urgent things always occur. So, how do you implement change and take advantage of that?
How do you do that? And the hard answer is, well, you got to pre-plan.
Okay.
It's pre-planning. But this is really interesting question. So, sometimes when you say what you just did of like, well, I'm going to do that or get to that, I just need an hour. I just need a day to sit down and think about it. Right. And then it kind of stays in there and that thing. And it's because a lot of times what you're wanting to do takes more than an hour to think through it and do it. It's a larger task. But this pre-planning about your APPE students or having pharmacy students with you during their fourth year or even during their introductory experience, maybe after their first or second year, depending on your program, that can take you maybe an hour of planning. Okay, so that is accomplishable. So let's take it 1 hour. That first step I want you to do is to look at your entire year. So colleges of pharmacy will provide you your full year list of students, usually in like February, right, for the next academic year. So you have time to see all the rotation students you're going to have for that graduating class. Like in this specific instance, there's 22 to 23. Next year's class is 23 to 24, right? So I know right now my entire list of assigned APPE students from that's going to start in May through next April. I know that right now. So I want you to look at your entire year and think about, okay, those big projects or things that you have going on, how can maybe it might be too much, right, for a 4-week student, a 4-week appy to accomplish during 4 weeks. So maybe thinking these long-term things of how does this maybe line up with when I have students? Because if you have students grouped up all together and you've got one every single month, that could be, it's one train of thought you could go down. But if you realize, like, I have 4 months without students and then they're kind of scattered throughout in the fall, or they're scattered throughout, that might impact on what you can do and when you want to do it. So that's step one. It's just like, hey, let's step back and look at when are they at for the entire year. And then the next step is to think about, to not make it, it's just how I communicate this with my other preceptors that I work with is just what are the things that are aggravating you right now, and what are the things that are causing you anxiety or are just like that I wish I could do this but I never have time to. Those are the things then you want to jot down to then try to map to when those rotation students are there. So you're starting backwards of like, here's my big hairy goal or the thing that's giving me anxiety. How could each of these rotation students throughout this year help me accomplish this? And so then you need to create a really specific syllabus. And I have a template of all this, and I have like little 20-minute videos that'll kind of walk you through this process. They're on the NCPA website, and I have a draft syllabus for you that you could actually download and use today too. But what's really important to once you've thought through, okay, these are some big ideas that really they can maybe help with, and walking it backwards down to specific activities, you've got to set that expectation with the students. And this is all prior to when they get there. That's why the syllabus is so important, that in your schedule, you are like, hey, student, I expect half of your day to be like doing all the fires and the people coming in and help us answer the phone and help us do these things. And then from 1 to 5, I want you to work on my long-term projects or these long-term ideas. And so you've got to just create that carved out time for them too, and that they understand and know what they're supposed to be doing. Otherwise, they might just stand around and start helping or just filling it because they're not really sure what you're expecting them to do. So it starts with big picture, then carved down and say, you're actually going to spend 2 half days of this week. I want you to think about this other project. Don't be sucked into my workflow today. I need you to be out doing these other things. So hopefully that's some tangible tips to get there. But there are some really good, it's under Preceptor resources under NCPA's website if you want to get the actual like syllabus and kind of some templates to help you through to implement these ideas.
Perfect. So it sounds like the key is to definitely pre-plan and be intentional. You're not going to accidentally accomplish an amazing goal.
Right. And sometimes it's just listening to this podcast. Great. Step one, you just doing great. You listen to this podcast. I've heard some preceptors who said, "Oh, I just really hadn't thought about that." I mean, they're just used to, okay, now you're hearing my workflow, which is great. Some students really need that. Some students really don't. And it can really help you with like maybe serving on your local CPSN board or serving on a committee that you're on. Maybe they can be the one that goes to this committee meeting and takes notes for you. Maybe they can be like, they can involve them in all of those things that you're doing outside of the busyness of the pharmacy. So you be able to carve out and go, oh, they can do things other than the busyness of my pharmacy. But recognizing that's still important, and you might have to individualize that based on their own experience. If they've had a lot of experience and they're like a ton of feedback, I'm really comfortable in community, then those students, I'm really thinking more like let's then aim more of your time to be on things that you've never done or to help us in new ways, right? So we have to of course be mindful of that. But some of my preceptors they've said, well, oh yeah, they can make those phone calls for me, or they can follow up with these, or write that meeting notes, or maybe go to that thing. Yes, absolutely. I mean, everything that you're doing to give back to the profession is something we need to show and involve them with, right? So yeah, absolutely. Sorry, that's really a big passion.
No, that was great, and it reminded me of talking with Amina back in North Carolina about her students that come in and how they have so much to offer because there's so much excitement and a new point of view, and how sometimes just that different point of view can be the key that makes you think about something in a different way and move in a different direction. So a lot of value in that, not to mention just the, that young ambition and excitement is so, if you could bottle it up,
Yeah, and I'm telling you, the students want this. They are just craving it, because you always have to put out there, like, see where your student at. Have they ever been here before? I've definitely interacted with students who's like, I'm not comfortable. I like that hospital. I've had all hospital. I don't know what this is. Okay, let's go back and go to the fundamentals and get you into understanding, seeing what this community side is. But if you have folks who are very comfortable in community, they're craving to understand what else they can do. They don't want to have the same rotation experience 4 times. They just
Sure.
don't. I mean, and I think it's, I think it's hard for us sometimes as we're being the deliverer of that learning experience of the appy to stop and realize and think, okay, what else has the student experienced this year already? And does my rotation look the exact same as the 4 others they've been on already?
Yeah.
I mean, it can be just a hard, like, oh, yeah, I probably should think about that. But yeah, they are. I think one of the things I said during my session at APHA was, if a student says, I went on this rotation and I did the same thing that I did as an intern, then we're doing a disservice to that student and we're doing something wrong. So, yeah.
Yeah, I think that's something that you'll hear from a lot of people who have been out of school for a while, is that, there was a lack of exposure to different experiences and different outlets outside of, a hospital pharmacy, or a big box pharmacy. But there are so many, nuances, and, the idea of the public health workers that you mentioned is such a fairly new concept. But for the next generation of pharmacy students, I think care planning and point of care testing and health, community health workers, all of these are fundamentals now that I think the next generation of pharmacy is going to move forward with. So one of the things that we talk about a lot is care planning and care goals. And that's something that you've definitely been a part of as well with Flipped Pharmacy. And, that's part of that fundamental change in like how you document that patient's care and document your effort. So how do you see that evolving in the education and the practical application, since you get to see both?
Yes. The educational side for me is the more controversial one. Like,
Okay.
I was like, what should we be doing? For me, it's a similar concept to the debate when I was in pharmacy school of, should we be teaching them dispensing software? Do we need to, how to work through Pioneer or how to work through QS1 or whatever it may be? And as educators, we're kind of go back and forth. Like, should that be in our skills lab? Should it not? Should we pick one? Does it do it? We don't know. Yeah, it's just kind of a more or debate thing. What I've seen some other colleges do, so there is a pilot program and I know several colleges have started the testing with the beta Pioneer. I'm sorry, I don't know the name of it. Obviously, I don't have it. And there's a testing side that Pioneer does. So some colleges have adopted that. Some colleges have adopted just hey, here's kind of regardless of what this might look like on the interface, here's what you're doing, and getting them to just practice picking codes and picking, like, okay, describe what you just did. You found a drug interaction or you stopped a duplicate, like stopping and documenting that too, just like you would if you were writing a soap note. But they're trying to showcase and bridge that this happens in community too. So in all of their community cases, you have to document all the errors in the care planning and things that you have you're assessing and worked with that patient about, where there's inhaler education, for example. So there's a lot of variety there. I think the core of it is what the latter part of that, of just showing students, hey, this is happening everywhere, and care planning and you coming up with a patient care specific plan, as well as what follow-ups and things you need to do as the provider, is location agnostic.
Yeah.
We need to do that everywhere. And so trying to see that and have them connecting those dots and working with that information that way is I think definitely the foundation where we need to start. Regardless of how many maybe bells and whistles, it'd be great to add on. And you're like, how do we do all that? Now, from a practice standpoint, this is where I feel like the appies are really, really, cornerstone and like, okay, please show them your pioneer. Please show them how you're doing this and what it looks like, because I just can't replicate everybody's,
Sure.
So show them where it is, how to do it. It's vitally important. And the way that I describe it to students, I did yesterday, orienting my new student for April, was, hey, we have to document all of these things, especially in community pharmacy, historically, have been really tied to that drug product. Every transaction, everything is just all about dispensing our dispensing medications, right? Everything that we track in there is usually about the medications. Everything else, whether it's an education point or you saw that something didn't look right with their adherence or didn't look right with, maybe other medications that they may be taking, and you're trying to figure that out, and you have a consult either with the patient or with the prescriber. What usually happens, it's usually written on a sticky note, stuck on the bag, they do it, and then they throw the sticky note away. And I was like, that is where my intervention just went. Like my intervention and my documentation is in the trash. And so the idea of the care plans and putting this into a codified way that is similar to every other, when all the every other health information is documented, is a way to show our value, and it's not throwing it into the trash. So step one is we have to document all of those things that we're doing so that we can prove to other people that this is what is happening in community pharmacy. One of the first studies we did with Flip the Pharmacy was like, let's look at every single care plan that's been documented and categorize them and just be able to showcase to the world, these are the things that are happening and being documented, can be documented in a community pharmacy setting. So it's just not, it's brand new. So it's things that people don't associate with community pharmacy. And so it's super important, one, to just demonstrate our value. Two, it can be really helpful of just you within your own internal team of knowing what's happened with the patient and what kind of services we provided them or what else conversations they may have had with us. And we're documenting those, and it's a place to go see that in Pioneer. Please don't look at my own personal profile because mine looks terrible because I use it as my test for my students. So I have every disease known to man. Because I'm like, look, you can do this, then we can do it this way. So I look terrible in my own my own profile. So that's really important. And then kind of making the connection to how does this transform practice, and all these pieces have to line up, right? You have to have the scope of practice. You have to be able to, of course, legally do it. You need to be able to get paid for it. To get paid for it, you have to document it. So this is that linkage in the middle. And so now that even in Arkansas that we have the scope through the protocols, one of the things I've done at my pharmacy is created templates within Pioneer for my care plans and for my oral contraceptive assessments. So I build out the template, like this is where we go, so we can document it all. It's kind of, some things pre-selected for us to make it easier on us. And that will be our documentation that we could go back and bill for later. There's still this, connection to what's the most efficient way and how do we get that billing across. But if we don't document it, then we won't ever be able to bill for it. And then the next stage beyond that, I think, is the ideal of our care plans being shared and communicated seamlessly with other electronic health system records, right? So that's kind of the trajectory that we've been on. But man, we've come a long way since 2018. I mean, it was on the...
We really have.
It really have. It's, and I try to put that perspective. This is one thing that students just never, they're like, well, I'm like, it's been really, really soon. They're like, that's 4 years. It feels forever, But I'm like, no. It was 2018 before we had the very first rollout of this on the marketplace. Like that is huge for us to be able, so I have to get away from just our sticky notes, to documenting our care, but a way that I think we make it more tangible. So there's that, hey, how is this valuable to me perspective, then you're really helping the greater good by documenting your plans right now, even if it doesn't go anywhere. There's that piece. But it really, to bring it home, because I know there's some pharmacies out there who are just like, why would I document it if it's not going to go anywhere? Like, that's always a question I get too. Like, well, there's one, the greater good. If we don't do it now, nobody will ever think we can do it. Number two, it's, well, when that payer is ready and we've got these stars aligned and we are almost there here in Arkansas. Actually, we have one active program that does use care plans right now for active billing and documentation. So when you're there, like when we got this, that's through a Medicaid program. We have a Medicaid program that says, we want you to focus on our behavioral health for us. So we have a program that's in for behavioral health, and they want you to start using it, and they expect it from day one. So if you're just starting to learn it, you're going to miss the boat.
Yeah.
And we're going to look bad to the payers.
Well,
So yeah.
and since 2018, it's, the care planning within Pioneer RX specifically, so in that area, it's definitely gone from, kind of from DOS to an iPhone where, before it used to be, a lot more manual kind of construction and entry, and it's gotten so streamlined and kind of smoothed out the rough edges through user feedback that now you can use care goals for something as simple as, recommending a probiotic or, nutrient depletion solution or something like that. And even if you're not planning on sending that outside the store, you're catching those opportunities, you're providing instruction to your team, and then you're documenting the results of that encounter. And what's great is you can make sure it's not going to trigger again next month. If they declined, you can wait 6 months. You just have more control. So, the use cases and the ease of use have changed immensely in the past couple of years.
I agree so much. And there's so much you can do, creativity around all of that flexibility and those options. I've heard a lot of people using care goals to set up for like their second shingrix shot, right? So, and just kind of, and it does have a value add to your workflow now, even internally. Absolutely.
Yeah. So, I'm definitely going to task anyone listening. If you can replace that Post-it note with something in your system, do that. If you reach for a Post-it, reach for your keyboard instead.
Right? I love that. Yes. When I started, truly staffing again, I just kind of had this deja vu of like, oh, sticky notes. Oh, they're everywhere. And I thought, okay. So I've, even within my own, trying to see, okay, where and when and why should I be documenting this thing that came across me today? And so I get both sides. And it is just so that's why for most of my for those who are struggling about using it or starting to use it, if there's something happening in your state, whether it's prescribing or even vaccines, take something that's actively happening that you're doing. Don't try to create a whole new thing that you've never done before from beginning to end, but something you're actively doing that's really important to you and your patient population, and starting to document that. Yeah, absolutely. And yes, anything you can document in the system, to please use that. I love how at every patient, when I was orienting my student yesterday, I said, okay, so Pioneer has on every patient profile, here's your normal screen. I said, you're familiar with this? Yes, I'm familiar with this. This is their patient profile. They have all of their meds in it. So there's this tab on every patient that says care plan right here.
Yeah.
Have you ever seen this? And they're like, no. Like, okay. So step one, it's on every patient, and it's really easy to get to. For each one. So I love that about that it's kind of incorporated as you have your med profile, and then you have like everything else, and that kind of their patient care profile essentially.
Yeah, and it's gotten a lot more streamlined so that that user friendly application where that the learning curve is minimal. I remember when my daughter, who's about to turn 10, she was like 4 and could pick up an iPhone and go to an app and unfortunately, make a purchase and then beat a level, right? Like everything was, so user friendly. You want it to be almost, easier to complete than to not complete. So we're coming up on time. I know we haven't talked a lot about day to day in the pharmacy, so definitely want to hear, what has the new normal looked like, or what are you excited about moving forward post COVID? Now that we don't have to concentrate solely on that for a while, hopefully.
Yeah. So one of my projects yesterday, and it took quite a bit of time yesterday, longer than I thought. So another plug for everyone else listening, learn from my time, and that it takes. I'm trying to credential all of our pharmacists to be able to recognize by our commercial payer here in Arkansas that we are medical providers, and we'll be able to bill on the medical side. And so in order to do that, you have to be individually credentialed. And so I kind of led with this is one of the projects I had my APPE student help with. So it was like, okay, here's all the things we have to do in order to be credentialed so we can bill medical claims once we, for assessing strep, flu, or contraceptives. We're going to get, or naloxone or smoking cessation, we can get paid for that. And so we all need to be credentialed. And so we were like, here's all the forms. So what do we need to do? And go find everybody's NPI number and everybody's license and everybody's liability insurance, and really getting that together. So this is one thing that I'm really excited about, is to see everyone be able to cross this space between, hey, all that we do in this day-to-day into this pharmacy it's just tied to the product, and we do prescription claims. I love this shift of, oh no, we're providers of care and we're going to bill providers this care. I think that's just really exciting, and it's huge. And there's a lot of like that pre-steps of just even step of just getting credentialed. That's going to take a couple of months. So for anyone listening that has these opportunities, like contact your commercial plans and figure out how to get credentialed with them. They have to know who you are, and they have to verify that you're a pharmacist able to give these services in order to even think about figuring out how to pay you. So that is an easy step one to get started. But that's the biggest thing I'm really excited about, is a shift. Some of those are expectations that are already set by patients, so you don't really see it. I don't really see, like, the patients are like, yeah, let's do it. Like, are we okay to come?
Sure.
Let's take my blood pressure, do my thing. And I'm like, oh, let's get everything else ready to do this so that we can continue to do this, in a very sustained manner. When I was first started working back in the pharmacy, it was to help with the vaccine clinics, because we had, usually 150 to 200 people we were vaccinating a day. And so I was able to spend my entire time like, I'm the vaccine person, and I'm running this clinic, and I can just easily see it with all these advances that I'm coming in, and my day at the pharmacy could be clinical pharmacist. I'm just doing this thing. I'm here to test and vaccines and do maybe some education and vital signs. Remote patient monitoring is another thing that I've heard a lot about, and we might get set up. So it's just, I think there's going to be a time where, like, you have full pharmacist positions and time that is spent solely on direct patient care services in assessment and management and prescribing. So I'm excited about all that.
Absolutely. And all of those areas seem to have minimal patient hesitancy if they can go to their local pharmacy and go see the people they know and trust and enjoy spending time with throughout their week, making multiple trips that sometimes are not even necessary, just as a social call, imagine giving them solutions as well. So
they're the least resistant folks. Like, the most resistant, it was like we are just creating brand new pathways with billing providers and stuff. Like, that's just brand new stuff, right? And we're breaking down walls left and right, and that's going to take time and persistence for sure. But then the next kind of like level of persistence I've heard or seen might be just, okay, getting everybody else to see like what pharmacists can be and the role that they're providing with the community, and maybe setting up relationships where it's mutually beneficial with other prescribing providers. But then the next resistance is more the pharmacists ourselves. We're like, wait, how do we do this? Because we got so efficient with doing things in the way that we've done it for 200 plus years. We're really, really efficient for doing that. So it's really the pharmacist going, wait, how do I step away? How do I do this? And so having a team around you and having the Slack resources is going to be so important during this transition for you to kind of find our new efficiencies and our new norms and those new efficiencies. So, but the patients are ready. Man, are they ready?
Well, I'm going to let you get back to it. We're coming up on time here. Congrats again on being the 2022 National Preceptor of the Year for the NCPA Foundation. Excited to see what all of your students are up to. So keep me posted. Love to hear about those exciting ventures out there.
I appreciate y'all so much. And thanks for having me on again. I just love being able to talk to you. So appreciate it so much. I hope y'all take care.
Thank you for listening to this episode of Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow Pioneer RX on your preferred social media platform.